Skin pulling with hand strikes? Whew. Well, I'm Doug Holland, LMT, and what I'm going to demonstrate to you is something that I only do on particular athletes or individuals that have been with me a long time that can handle deep pressure sports massage and neuromuscular therapy. What I'm going to show you today, I'm going to ask you, please do not do this on any of your new patients. Let me repeat that. Don't do this on new patients. First of all, you're probably never going to see them again. But secondly, they're not going to understand why they can actually have bruising from this. So just a quick description. What we're looking at here is hypertonic tissues in the upper thoracics from a kyphotic posture or from sport where they're overactivating those muscles in that particular area. So the skin, the fascia, and the muscle will glue together. And we'll take our elbows and we'll try to drive it apart. We'll use our palms, our knuckles. We'll do all these things. But where the real action takes place is by lifting the skin off that fascia. This is painful. The patients have to understand it is painful. But I have a way of doing it where it spares the practitioner. When you're squeezing with your hands, you'll see in the video as you're squeezing with your hands, if you're trying to apply all the friction along with the grip, it'll quickly fatigue the practitioner. So I have a trick and a tip on how I do this. So we're going to get down the table and we're going to have some fun. So it's important before we start is that we don't have any lotion on our hands whenever we're doing a lifting skin technique. You want to make sure the patient is definitely advanced or has experienced deep tissue massage before you do this kind of work. But what we're going to do is with dry hands and dry skin, we're going to actually lift the tissue off the body and really try to get a separation between the subcutaneous layer, the fascia, and the muscles themselves. So what we're going to do is I'll demonstrate. We'll get a little bit closer here. We're going to start here in the thoracolumbar area, and I'm going to go ahead and grab the skin right between the spinous process of the spine and out here to the outer part of the ribs here. And if you notice, I take my fingers and I get them just on that laminal groove right there, just in that little scoop spot. And I take my thumb and I make it parallel with the spine. So you can see my thumb's not like this. The thumb is parallel to the spine. My hand is flat against the skin. And what that's going to allow me to do is get the greatest amount of pull. So I squeeze in. You can see the skin is now coming up. And then I lift. And then I hold. Now as I'm lifting, I would want to shake with my arm. That would be the normal response, is you grab and shake like you would trying to wring out a towel. But what I found that actually works better if you get a hold of skin is to use the other hand and simply tap. Now as I'm tapping, it's forcing the skin, the fascia, and muscles to separate. Then I just simply move my hands just a little bit. I go into that groove, I lift the skin again, and then I tap. You can tap harder like this, but I find that a softer tap like this is a higher friction rate, and it allows. Now what's happening is the skin is slowly pulling away from my fingertips. Okay, and then I'll just move my hands. And as you tap, you'll feel the skin just barely sliding off your fingers. And then we'll go ahead and then we'll move down. And depending on the practitioner and where the area of the problem is, if it's upper trapezius, if it's the lower lats up in here, if you're trying to get up into the neck area, you will move your hands accordingly. So I'm going to go ahead and demonstrate. My daughter's going to go ahead and videotape this, and you'll actually see me do this work for about 8 to 10 minutes, okay? I'm not going to talk a whole lot while I'm doing this, but You can see the skin's getting redder. I think you get the benefits of cupping, cross fiber friction, and as you squeeze, compression. This technique is good for people that sit at a computer all day. They have a kyphotic posture. Now, in between to give yourself and them a break, you can do some skin rolling. And if you're not familiar how to skin roll, basically you have your two thumbs behind the fold of the skin, and then you're lifting with the forefingers and just letting the skin roll behind the thumbs themselves. And I like to kind of do this in between just to kind of loosen things up a little bit. As you can see the roll there. Can you see how big the roll is in the video? Can you see from the, I don't know if you can see from the side, but see how much skin I'm getting up? You can see how high I'm lifting it. And this does absolute wonders because you're dealing with it's really hard to get to the erector spinae group underneath because we have these other superficial muscles that are on top here. Hold on one second. I'm going to go ahead and turn this light back on. It's really hard to get to these deep erector muscles because you have the higher superficial muscles that kind of get in the way of what we're trying to accomplish. Actually, for the purpose of the camera, I'm not even going to be able to get to the other side. You really won't be able to see this. But now if you're working in the shoulder area right here, go ahead and grab a hold of the skin fold like this. And we're not going to pinch real hard. But again, all we have to do is I'm pulling and sliding all the way down the shoulder itself. I'm just allowing my fingers just to move ever so lightly. Again, this takes a really advanced client. Mark's been coming a long time, so he can handle this. You wouldn't want to do this on a new person. They couldn't probably handle it, but what this allows us to kind of trick the nerves, because if I just squeeze and I drag my fingers, that's not going to feel good with no lotion on. But if you do it like this, it kind of tricks the nerves and allows us to get the work that we want to get done. And you can use the same thing if you want to get up underneath the shoulder blade, as long as you don't have any nails. You don't want to have any nails. Of course, I make sure mine are trimmed way back. But if you do have nails, just use these the furthest parts of your knuckles here. As you can see right there, that nice little ridge. You can tuck it up underneath, and you can do the same thing. You just get it up underneath, and I'm working superiorly, so I'm just kind of I'm using my knuckles to hook in. You can see where the printing of my knuckles are to get up underneath the scapula itself. You want to stay away from the kidneys when you're doing that, any percussion. We don't want to have any renal problems. But if you know, some people, their skin is so taut or so tight that your nails will cut into the skin, even if you don't have a lot of nails. So sometimes it's better just to go ahead and use those further knuckles. This way, you can try, but it seems like it actually hurts you more than it hurts them, right? Here, it seems like it feels real natural to have your knuckles go up underneath the skin itself. So that what makes this nice is that this is basically, we're using percussion along with skin lifting and rolling without just the one arm doing all the work. I hope that makes sense. But as you can see, look at the blood flow in there now. Look at that nice blood flow. Look how much looser that is. You can see this is stiff, and look how loose this is. Oh, there's a good example. Look at the difference. Look at the difference in how the skin's moving. Right there. So this is a whole lot looser. Again, no lotion on the hands. You spend about 5 minutes on each side, so about 10 minutes. You will really loosen up your patient with that particular work. Well, as you can see, you can work up a sweat doing that. I certainly did. And it can be tough on the practitioner's forearms and hands, but it's a whole lot tougher on the patient itself. They will be sore the next day. Whenever you do this kind of work, there could be bruising, just like if they were having cupping done, and we all know what cupping is. There could be bruising. There could be a sensation of pain in those areas, but 2 or 3 days later, they will feel amazing as all that tissue lets go, and that's the goal. So if you like this video, please hit like and subscribe. I'll try to make more videos on the techniques that I do in my office, especially on athletes. I'm going to even show you more and more athletic massages, and we'll just go from there. Just remember this, though, especially in this office. If they have no discomfort, well, it was nothing more than a foo-foo massage.